Good evening. This is Josh Goodwin at Regenexx Las Vegas. We're just going to get started with the webinar. So again, my name's Josh. I'm the doc here at Regenexx Las Vegas. I'll be going, quickly through this webinar, basically talking about alternatives to orthopedic surgery and the Regenexx approach and the different options we have to help treat orthopedic conditions. This webinar is more of a general overview of kind of how we go about making decisions, briefly talking about the different options that we provide and that are out there for people to explore for their orthopedic condition. It's not the most in-depth for each specific condition, but more of an overview so people can get a sense that there are different options, understand how we go through the process at trying to decide if these options are a good fit for the patients that we see. And then there will be some time at the end for questions. If anybody on the webinar has already been to the clinic and had a consultation, this will basically just be a review because it's just more of a general overview of the things that we do and the different options that are available. As I mentioned, there will be a Q&A. There are those web chat and question and answer sections that you guys can type questions in that I can get to at the end. I probably won't stop in the middle to cover them, but they may be answered as we go along. And but feel free to write questions. Just to get into a little bit more about who I am. So again, my name's Josh. I grew up in New Mexico. I completed medical school there, so I'm a medical doctor. I'm board certified in physical medicine and rehabilitation. I did my fellowship training in sports medicine and interventional spine. I've been with Regenexx for almost a decade, so I joined them in 2015. And again, we'll talk more about Regenexx, what we do, our approach, our history, those kind of things. So I've been doing this a while. I'm a co-author on review article for stem cells for low back pain. I've been at the clinic here since 2018 in Las Vegas. I was at the corporate headquarters for Regenexx in Des Moines, Iowa for 3.5 years to start. So that's a little bit about my background. So I'm not a surgeon, but I do a lot of non-surgical orthopedic care. That's kind of my background in trying to prevent the next steps. And so why would we want to talk about, orthopedic conditions, muscle, tendon, joint, spine conditions? It's because a lot of people are affected by pain or injury or degeneration, and they can create significant dysfunction at all different age groups. The cost to treat these conditions is quite expensive. And so surgeries, injections, medication, lost time at work. And most of us know someone that's dealt with an orthopedic problem, whether that be a knee issue, a back issue, a shoulder issue, a thumb, hand, foot, whatever it is. Most of us have had some issues with this. Some of them are very brief and transient, and other times they can turn chronic. And we get to be familiar with the different traditional treatment options, with different medications, steroid injections, physical therapy, bracing, and sometimes surgery. And so when we are dealing with an orthopedic condition that may necessitate, treatment outside your typical resting and activity modification, it's good for us to be aware of the options, the risks and benefits of these options, and that in all is going to help us make decisions on what we want to do for our bodies. Because even something as simple as taking an ibuprofen chronically can have problems. So those non-steroidal anti-inflammatory medications are associated with deaths, heart attacks, stomach ulcers, blood pressure issues, kidney issues, and more data coming out that when used chronically, they can actually increase chronic joint pain and pain from degenerative conditions. So long term, they actually may be detrimental for the things that we often use them for. So it's good to understand what we're doing and why and what the potential risks and benefits are. The same goes to different injectable type solutions like cortisone or steroid injections. While these can be a good, strong anti-inflammatory and help improve pain related to injury, swelling, inflammation, arthritic changes, those kind of things, they do come with a host of potential complications from just affecting blood sugars, weight gain, anxiety, and they can be especially toxic to your cartilage, your bone health, your tendon health. They can lead to advanced degenerative changes. They can increase or kind of shorten the timeline to a joint replacement. So we got to be aware of that before making the decision to undergo a certain type of intervention, right? So just highlighting these things that aren't often discussed when we are seen for orthopedic conditions. This is just kind of highlighting the fact that knee steroid injection increase the risk of requiring a knee replacement. Again, some complications from steroids into hip and knees, which can include osteonecrosis, so bone death, rapid joint destruction, bone loss, all these things that we should be aware of before, undergoing those things and making the decision for that. Sometimes it's a good choice, but we have to be aware of all those things. And ultimately, if people get to a time where they're told they might need surgery, again, you need to be informed on what that means regarding success rates, failure rates, complications, all that stuff. So for example, spinal fusion surgeries carry significant complication rates in that 20 to 30% range, and up to 60% for minor complications. And some of these can be infections, tears within the spinal column, nerve and blood vessel injuries, hardware failure, revision surgeries in the future, all those things. So we have to understand what we're getting in for. Knee replacements can carry up to a 16% serious complication rate. Knee scope procedures like arthroscopy can carry up to a 5% complication rate. And just because people get surgery doesn't mean that all of a sudden you're fixed, so the main complication after knee replacement is continued pain. So it doesn't mean you get back to full function. It doesn't mean you have less pain, or maybe you trade one pain for another pain. So now we have to start to say, okay, what does this mean? What's the chance of getting better? What's the overall risk of undergoing the procedure, etc. Now we're going to start to get into some of the things that we do, the injection-based modalities that we have, which again is just the evolution of medicine. And we've done some analysis on a long time frame of close to 10 years, looking at 2,300 patients undergoing platelet and stem cell-based treatments for orthopedic conditions with a very low adverse event rate compared to the surgical alternatives. So again, we have to start to understand what are the risks, benefits, what are the alternative treatment options. Well, we obviously have to see how effective they are, and that's going to depend on your condition. But it's good to now understand that there can be a difference in what you're exposing your body to. Now, who is Regenexx? Now, Regenexx is a large physician network that's around the US and around the globe. We're one clinic here in Nevada, in the Las Vegas area. That's part of the network. And like I said, I've been a part of this network and doing these types of procedures for about a decade, but it started in Colorado, and now they're all over the United States, some international clinics as well. And the whole process always has been to innovate in the lab, perform clinical research, track patients, and use this data to help guide our treatment decisions and our education process. And then also be involved with publications and helping educate other physicians and patients and those kind of things. So this is always our process. We continue to track patients in our registry. We have roughly 80,000 people within the registry. And at least at the medical headquarters, they're undergoing randomized controlled trials, currently one for low back pain and disc degeneration. And really, this is just trying to progress and advance the medical specialty of orthopedics and trying to utilize knowledge that we gain over the years with understanding healing and different components of that we can take advantage of, performing more minimally invasive procedures that inherently carry less risk, and trying to help preserve tissue as opposed to remove tissue. And this is going to lead to less risk and less downtime. And so we're going to see that these aren't the right procedures for everybody. Not everybody's a good candidate, but the more we can educate people on understanding the different options available, sometimes we can catch people and help prevent that progression to more advanced changes that are going to lead to more invasive procedures. And so that can be helpful for everybody involved. We call the different things that we inject orthobiologics. So we're taking advantage of our biology and utilizing them in the orthopedic system. So having a brief foundational understanding of our bodies and some healing processes is important. We all understand that we have the chance to heal. We can cut ourselves and grow new skin. We can break a bone and grow new bone. I partially tore my Achilles tendon when I was 17, and I never got surgery. I got casted and my tendon healed. So we sometimes have to heal from surgery. So even with surgery, you have to heal from that. So we do have the capacity to heal certain types of injuries. Now, sometimes the ability to heal can be compromised for different reasons. That could be from overuse, that can be from injury, that can be from tissues that don't have good blood supply or a delivery mechanism to get healing components there. Our cartilage and our discs, our joints, our meniscus, our labral tissue does not have direct blood supply or very limited blood supply. Bone fractures notoriously heal unless you disrupt the blood supply. And so those are the cases in which we start to get degeneration or kind of a destruction of that tissue, which can then start to become painful. And so we can take advantage of components of our blood, components of our bone marrow, proteins that help control inflammation, to keep our tissues in good homeostasis and balance, to try to prevent that destructive process that can happen with overuse or chronic inflammation. And we can utilize these components to help facilitate and improve the healing process and allow our tissues to do what they can do. So one of the cells that we use are platelets. And so platelets are found in the blood. They have many functions to include clotting as well as activation of healing. So for example, when you cut yourself, platelets help in part stop the bleeding. They're bound up in the injury site, and then they release these different growth factors to assist in the different things necessary to repair that injury. We utilize platelets, which is called PRP, platelet-rich plasma, for mild to moderate arthritis, tendonitis, bursitis, small tears, a lot of spinal conditions with the disc, irritated nerves, carpal tunnel, peripheral neuropathies, those kind of things. There's data to show that this can be helpful. Again, it depends on the severity of the problem. There are other proteins in our blood, one of them being called A2M, which is a very strong anti-inflammatory protein, which can be used to help those joints that are arthritic, that have this chronic inflammation swelling process, and can be helpful in those situations. Typically, people hear about stem cell type procedures, very specifically mesenchymal stem cell procedures. In the lab, these cells can be forced to transform into different types of cells, to include bone, muscle, tendon, cartilage type tissue. Naturally, these are found throughout your body and joints, around blood vessels, in your bone marrow, in your adipose tissue, and can be isolated and concentrated, and used their properties to help with degenerative conditions, traumas, injuries to muscle, tendon, ligament, bone, cartilage, and discs in your back. So we tend to utilize these for more moderate to severe conditions. Again, there's some limitations to what these can help. And we're going to get into how we make that decision within our clinic. But it's always important that not everybody's a good candidate. These are not helpful for everybody, but they can be a good tool in our tool belt for the right patients. Just to highlight that each one of these circles and squares are studies that have looked at stem cell use for orthopedic conditions. So when people say there's no data out there, we just have to point them to some of these graphs to show that there is lots of different studies. There can always be more, higher level, more refinement in things, but even with platelets, like we talked about, lots of randomized controlled trials looking at it for all different conditions, from knees, hands, hips, shoulders, carpal tunnel, elbows, back, ankles. So it's important to know that there is data, and we have to utilize that data to help us make decisions. Now, how do we and how do I go through the process on evaluating patients to see if they're a candidate for what we do, what type of candidate, what have we seen in our patients? And again, it's about education, understanding what your condition is, what the options are, what the risks and benefits and outcomes are, and then you make a decision on what makes the best sense for you. And so we have these three components: prediction, our processing, and the precision, the delivery of those cells to the problem that helps improve the chance for success. So again, we treat only orthopedic conditions here. So the prediction process is basically we perform a new patient evaluation. We've tracked patients for many years, so we have a large registry to get a sense of candidacy, and then understanding the available research is always important as well. Our consultations are about an hour long, so they're more in depth than your typical orthopedic evaluation. We'll walk through imaging. We can perform ultrasound in the clinic, perform physical exam, and try to understand what's going on. And then we can utilize this along with our registry to see what kind of candidate are you, what's the chance for success. We can't predict precisely your outcome, but we can look at the averages and what percentage of people get better and try to best educate you on what that means. Ultimately, you have to make a decision if that is enough and it makes sense. And then we can move forward with, the procedure and the scheduling and that kind of stuff. But we utilize all this information, our published research, the clinical studies we perform to help guide those recommendations and help us educate you on your overall condition and the available options. We try to talk about all options, not just what we perform. Now, this whole evaluation, the registry, understanding research and where you fit along with what's available helps us grade people from high, moderate to low responders. And this is different for different joints, different parts of the body, based on different age groups, those kind of things. So there's no way to kind of generalize it to people will ask, what are the success rates? Well, the answer is always, it depends. It depends on you, your problem, the severity, the location, other medical factors, medication factors, those kind of things, physical exam findings. Now, if we ever did think someone was a candidate and wanted to move forward with a procedure, another important component for orthobiologic treatments is a good platform to isolate, concentrate, purify, and customize the products that you're using, because dosing matters and everybody's different. So your plan should be customized towards your situation. And so we do have a flexible lab platform that can customize cellular concentrations based on age, injury severity, location, tissue type. Do we need multiple different products for the different conditions we're treating? Are we treating a nerve or disc space versus a shoulder and tendon? Is someone 18 years old versus 70 years old? These are all things that need to be taken into account when recommending what should be done, and then what concentration and dosing and delivery would be recommended and optimal for the problem. Next, once you have the right concentrations of cells, you want to be able to deliver them to the right areas. And so we never perform blind injections. If you're ever getting an injection, it's always good for someone to use guidance, whether that be X-ray or ultrasound. And again, it's always good to understand the problem. Like this MRI showing cartilage wear behind the kneecap and a little bone injury with this white area here. And the corresponding treatment imaging highlighting precise placements for the injection. A shoulder X-ray can be utilized to ensure you're getting good flow in the joint or the labral tissue. Or ultrasound imaging can be used, for example, injecting platelet growth factors for carpal tunnel syndrome around the median nerve in the wrist. And so this is just kind of our process and what we think is important for educating patients, helping them understand their condition, helping maximize their outcome from delivering a customized plan for their problem, and then precisely getting that to the area. So these are components if people go elsewhere for similar types of treatment, that there's a standard that should be there for all injection-based modalities, utilizing platelet or stem cell type treatments to ensure people are going to at least have the maximum chance to get better. And so when we're looking at, say a platelet type procedure, this is a 1-day process where we do blood draw, processing, and injection in the same time. Again, this is all dependent on your evaluation, what we find, what we recommend, what the potential is, what your chances are. Now, people, anytime you get these types of injections, it is creating a healing type inflammation temporarily. So you do get sore and stiff. There is typically some recommendations for reduced activity for a couple days to a couple weeks, and then a slow return to full activity. Some people need physical therapy. Some people need more than one treatment over time. And some people need to escalate care if they're not getting better. So again, those are all the things we try to discuss. When we're utilizing bone marrow-derived stem cell treatments, so bone marrow concentrate, which contains those mesenchymal stem cells, sometimes we'll have just a standalone injection if we're just treating an isolated tendon tear, or we might have a 3-step process that's a little more involved to try to enhance the overall outcome based on our data. And that's typically for more severe degenerative conditions like more moderate severe knee, hip, shoulder arthritis. And so that's our more involved process when treating joints that are a little more advanced in their degenerative process. Now, we always like to end just to say that there is limitations to all this. So we don't want to kind of give the message that, these types of procedures are the right thing for everybody, that they completely regrow all your tissue, that, it's 100% effective, because people do say that out there. Basically, we look at this as a tool that's the right tool for a lot of people, but not all people. And there's some varieties in response for different conditions and people that we don't even know how to predict 100%. We do have to remember that FDA regulates a lot of different cellular-based treatments, and we have to be aware of those regulations and what's compliant and not compliant. We do not offer umbilical cord stem cell injections or an umbilical cord product injections here because of FDA regulations. They're technically illegal through FDA. And we've checked a lot of the products, and most of the US products that say they have umbilical cord stem cells are either dead or do not contain any live stem cells, as this study looked at many different products that are called umbilical cord stem cells that were unable to grow any stem cells compared to a middle-aged person's bone marrow derived cells. So we don't utilize at this point. Maybe in the future, as the studies grow, we might be able to do that. And as we get some clearance through some FDA trials, which are underway. So we'll have more options, hopefully in the next 3 to 5 years. But at the moment, we are mainly utilizing cells from the person's own body. Now, we do have some other types of non-invasive treatment options to include laser, hyperbaric oxygen therapy, and other kind of recovery systems that can be used as adjuncts to procedures, or if people do need surgery to help with recovery. So let's get down to some questions. I'll try to go through that pretty quickly just to kind of get through it, just to see if I can answer anybody's questions. I just wanted to also highlight, to give people some time, that if people need to schedule an appointment, that it's best to call this number down here at the bottom to get in touch with our call center, education center, and they can get you more information on how to get your imaging to me for review, or how to get scheduled for an appointment, or just to answer other basic questions. Does anybody have any questions for me? You can write them down. People will usually want to know, number of treatments. That can vary depending on the condition. Spine can sometimes have a little higher repeat rate of injection of about 30%. Other joints can maybe be 10 to 15% of patients might need more than one treatment. Again, it sometimes depends on the baseline severity of the problem. The risks, most of the risks are involved with the needle placement and just putting something into your body. Even though it's a small, needle, there's always risks to that, even though it's small. It's never zero, but we might see some bruising, little soft tissue irritation. People get that expected response with soreness and stiffness post-injection. And then obviously, if you're doing other things like spinal injections, there's more risk for nerve irritation, those kind of things. So it says, have you treated meralgia paresthetica at your clinic? Yeah, we've treated meralgia paresthetica here. I mean, I've seen it in different settings, whether I was here or just in history, seeing patients with that. We can treat peripheral nerves. So that can be the lateral femorocutaneous nerve that wraps around the front part of the pelvis, which can be impinged for different reasons. And so we've treated that in the past. Try to get a sense of why someone might have that, whether it be from external compression, from heavy belts, construction workers, police officers might get that, weight gain or weight changes, all these different trauma, surgery, these kind of things. So but we have. And so understanding maybe the potential reason why can help us have a better sense of, what we would want to do about it, what the success rates may be. We tend to utilize more PRP or a platelet growth factor treatment for that. If we felt you even needed that, it just depends on what's going on, but it's something that can be treated. Most PRP and kind of bone marrow or stem cell based treatments are not covered that much through insurance. So most of it's self-pay. Regenexx as an organization does have corporate coverage. So we have 2,000 or more companies that cover it for their employees that are self-funded. So there are people that do have coverage through their employer. There's 2,000 of them, so I can't name them all off the top, but there are some people that have access to coverage. So that's very helpful for those people. So it's always good, depending on where you work and if it's self-funded, to see if if they're not contracted with Regenexx, that we can always get them in contact with our corporate team. So it's kind of unique to our network and organization because nobody else really has that at this point. In the future, obviously, we hope to have more coverage for everybody, but anytime we do a procedure, we do follow up with patients on a regular basis to make sure people are getting better. We want to have some follow-up just to make sure we're staying on top of everybody's progress. Let's see if there's any other questions. So no other questions at this point. Obviously, you can always get a hold of the call center. You can call our clinic. If you have more questions that come up, you can send in your imaging for review to see if it's worthwhile coming in for a consultation. That's just a free MRI review that we say there's options, there's not options, those kind of things. No downside to understand and get better educated on your condition. So it's not really a downside outside of some time. We can do Zoom consultations, all these things, as long as we have imaging. We like imaging to be within 12 months of the condition, or if there's symptom changes, to get more updated imaging. We are contracted with insurances for consultations, and so people can utilize that as long as we're contracted with it. So a lot of ways to get educated, to find out different options, and just to understand what's available. So I thank everybody for joining me, taking some time out of your evening to hop on the computer and just listen to me talk to my computer. But reach out if you need us. Otherwise, I hope you guys have a good evening. Thank you.